My name is Mary Malachami, and my presentation is over the effects marijuana has on prenatal and infant development. I included a PowerPoint for my visual aid for the presentation. So starting out on slide 2, what is marijuana? Marijuana is a mind-altering and psychoactive drug. Our society has seen it negatively over the years, but within the past decade or so, we're starting to shift to see it more positively and with all the benefits that it holds. It has many different health benefits like pain management, which can help with symptoms of cancer, regulate seizures and diabetes, and help lessen chronic pain. It has also increased in popularity over the last decade to become one of the most widely used substances. Slide 3 talks about the demographics of those who use marijuana. Like I said in the last slide, it is the most widely used substance in the US. 44% of people aged 12 and up have reported using marijuana at some point in their lifetime. In addition to that, 4 million Americans meet the DSM-5 criteria for cannabis use disorder. A couple statistics that were shocking to me in my research was that women of reproductive age who use marijuana has increased by over 50% since 2008, and that 1 in every 20 women in the U.S. reports using marijuana while pregnant. The U.S. National Survey on Drug Use and Health conducted a study with 171,146 women from ages 18 to 44, and they found that 59% of women who used were white non-Hispanic, 18% were Hispanic, and 14% were non-Hispanic African Americans. On the next slide is the availability of marijuana. The availability has increased again within the past decade due to marijuana laws in several states. Only 4 states in the U.S. currently do not have any cannabis programs. All of the other ones offer marijuana in some way, whether it is medical, recreational, or a CBD and low THC program. In addition to the actual availability increasing, the perceived availability of marijuana has increased in people who are 26 and older. And once people feel that marijuana is more available and less stigmatized, they are more likely to use. Slide 5 is why pregnant women use marijuana. The number one reason pregnant women use marijuana is to eliminate stress. There are so many different situations like losing a job, having financial difficulties, and worrying about how to support their new baby financially. Maybe they're caring for a sick family member or have relationships problems, or maybe they've miscarried in the past and are worried about the one they are currently carrying. Using marijuana to get rid of the stress and anxiety of being pregnant and the other factors going on in a pregnant woman's life is actually counterproductive. Women who continue to use to lessen their stress are more likely to be stressed, depressed, and have higher symptoms of anger than those who do not use. They have higher levels of anger and stress. Their higher levels of anger and stress can lead to poor infant regulation, which interrupts development of regulatory behaviors, and it can also reduce or slow the fetal growth when extra stress is put on the mother and the baby. Slide 6 continues as to why people use marijuana. The health benefits of marijuana can be great for eliminating symptoms of morning sickness like nausea and vomiting. Women who have morning sickness are actually 4 times more likely to use than women who do not have morning sickness. The problem with using for the health benefits while pregnant is that there are so many health problems that can occur for both mother and baby. The American College of Obstetricians and Gynecologists strongly recommend that pregnant women discontinue the use of cannabis and recommend they switch to alternatives such as essential oils and nausea medications. Slide 7 talks about the last reason why people use marijuana, and that is because it has become more socially acceptable. Not only is it more socially acceptable, but it also has increased in social settings. Society and peers also increase the pressure to use, but they also carry false perspectives or misconceptions about marijuana that can be harmful. Since there is a limited information that is available or provided to pregnant mothers, many will rely on their friends for advice in determining whether or not using marijuana is a good choice for them. Slide 8 is about the prenatal physical disabilities and abnormalities. 34% of women who use experience prenatal exposure that results in physical disabilities or abnormalities. The most common being a decrease in gestational age and an increased odds of preterm delivery. Low birth weights are also common with an 84 to 256 gram difference from normal birth weights, which is about 3 to 9 ounces. This doesn't sound like a whole lot, but the small difference puts these newborns at the 5th to 10th percentile on a normative growth rate curve. The study that I found interesting that included many of the physical abnormalities that occurred is the Warshak study. In the Warshak study, there were 13,859 infants who were exposed to marijuana from contraception through the first trimester. The results of the study found that these newborns had an increased risk of being born without parts of their skull and brain, having defects of the esophagus, abnormal openings in the diaphragm, and an increased risk of being born with their intestines outside of their body. Slide 9 continues the physical disabilities in prenatal development. There are about 10 different secondary outcomes that are linked to marijuana usage. A few of them include an abnormal opening in the heart, a disorder where blood is pumped into the lungs, defects of the spine and spinal cord, having a small head size, and musculoskeletal defects. The placenta is also a very important part in prenatal development. Cannabinoid receptors can attach themselves to the placenta, which then increases the chance of placental abruption. This is one of the main reasons for preterm births in mothers who use. Slide 10 is the prenatal cognitive disabilities and disorders. After THC crosses the placenta, it attaches to the cannabinoid receptors in the fetal brain and the placenta. THC can circulate in those places for up to 5 days. In those 5 days, the THC impacts the baby in some of the same ways it could be impacting the mother, with symptoms like increased hunger, decreased reaction time, and moving slower or not as often. One other impact of THC is that it can decrease levels of dopamine receptors in the brain. On slide 11 is the physical disabilities or abnormalities once the baby is born. Marijuana use during pregnancy affects both growth and brain development. It does this by the THC stunning growth due to the high density of cannabinoid receptors in the frontal lobe and the cerebellum. The infant could then be born with underdeveloped lungs, heart problems, and decreased motion in arms and legs. Another impact is that mothers who breastfeed while using marijuana will continue to transfer THC to their infant and can result in decreased motor development and slower reaction times later in life. The infant's cognitive disabilities and abnormalities are on slide 12. One abnormality is an altered response to visual stimuli. Babies could have an increased trembling and a high-pitched cry. The high-pitched cry is shorter than a normal cry and has a higher percentage of dysphonation, or a hoarseness in their voice. They can also develop increased impulsivity, hyperactivity, memory dysfunction, and a decreased IQ scores later in life. They will also have a harder time regulating their emotions than a baby who was not exposed. In extreme cases, babies will show substance-seeking behavior and withdrawal symptoms of marijuana. Later in their childhood, the same children exposed can show gaps in their problem-solving skills, memory, and their ability to retain attentiveness. Slide 13 is a doctor's view of marijuana. Healthcare professionals who work with pregnant women often provide their patients with limited to no information on the risks of marijuana. This raises questions of why do they provide so little information? One explanation is healthcare professionals' own ignorance. Healthcare professionals do not like to reflect on whether or not marijuana can cause harm or can serve as medication, since it is not a widely accepted community practice. Another explanation is that they do not have enough knowledge of the substance. Healthcare professionals could not have enough knowledge of the substance and its effects to be able to make an educated decision on it. The benefits have also not been studied long enough for them to be able to feel comfortable in prescribing it to their patients. Healthcare professionals are also trained to follow not only the medical authority but the governmental authority as well. They could suffer from some disciplinary actions when not following a widely accepted practice. Some healthcare professionals even feel like marijuana will turn out like the opioid epidemic. On slide 14 is the fear of judgment or punishment a pregnant woman could have. Pregnant women who use marijuana are stuck between a health concern and a criminal justice concern. They are afraid to seek medical attention and are even afraid of going for prenatal checkups in case they will be asked to take a drug test. Since healthcare professionals are mandatory reporters, they fear that they could lose custody of their baby and the other children they might have, since the substance abuse while pregnant is child abuse under civil child welfare statutes in 17 states in the U.S. Even if they choose to seek help, there are limited resources available for pregnant women who use marijuana due to the criminal justice's focus on punishment and not treatment. 15 is society's view on marijuana while pregnant. There has been a dramatic increase in the number of young people who use and an increase in society's positive perception. Many people no longer see marijuana as having serious consequences like those of cocaine and ecstasy. They think that it has no more harmful they think that it is no more harmful than using tobacco or drinking alcohol. Misconceptions has also played a role in the new perception people have for marijuana. One is that it is not as harmful to use while pregnant. This misconception occurs the most in teenage mothers. The second is that marijuana is not addictive, but 64% who enter treatment for substance abuse enter with marijuana being their drug of choice. The third misconception is that it is not as bad as cigarettes. Marijuana actually contains many of the same chemicals found in tobacco. Smoking marijuana also might increase the risk of cancer more than tobacco does. The 16th slide is about educating society. Since there has been such an increase of people using marijuana, education needs to be increased as well. Healthcare professionals need to be able to release the stigma behind talking about the benefits and risks to their patients. To be able to educate as many people as possible, educational materials should be made available in places like schools, hospitals, the workplace, and treatment centers. In addition to having educational materials available, we should also try to create a more safe place for open conversations to be able to talk without fear or judgment. Slide 17 is the changing marijuana laws. Currently, marijuana is still illegal for everyone on the federal level, but many, and actually almost all states, now have legalized marijuana in some way, whether that being recreational or medical. In many of these states, women are still allowed to obtain a prescription for marijuana or purchase marijuana from a dispensary. By changing the laws, we can prevent women from being prescribed marijuana, which can help prevent health defects as well as criminal charges. The last slide is looking towards the future. In the future, we should try to eliminate the misconceptions that people have on marijuana usage. Healthcare professionals also need to inform expecting mothers of the benefits and risks of using marijuana so they can make a more educated decision. Educational materials need to be more readily available to properly inform everyone of the risks and benefits. Lastly, future research on this topic should focus on eliminating other variables that could contribute to any error in their findings, like using other substances in addition to marijuana.